afternoon, everyone. Good morning and good evening, wherever you are in the globe. I'm Dr. Raymond Francis Sarmiento from the National Telehealth Center, University of the Philippines, Manila. Today marks our second episode for Season 4. Last week, we kick-started our discussions in terms of the COVID-19 variants. But for this week, we will be discussing our readiness, the Philippines' readiness in terms of our vaccine deployment and preparedness. And as mentioned, we have really an spectacular panel of speakers, and we hope you will continue to join us and be with us until the end of the show. And together with Dr. Susie Pineda Mercado, who is the Special Envoy for Global Health Initiatives, and also the Adjunct Research Faculty for the National Telehealth Center, we hope to be able to bring to you important information related to the vaccines. So without further ado, I'll call on my co-host and my mentor, partner in crime, Dr. Susie.
Thank you very much, Raymond. Magandang hapon po sa inyo lahat. We'd like to welcome all of you to the webinar wherever you are. And vaccines. We're talking about vaccines, but we have to learn, we have to know. And I just like to greet, Raymond, all of those who are watching from all over the country. I can't name everyone, but we do have our listeners from Quezon City, from Leyte, Mikawayan Doctors Hospital, DepEd in Taguig City, Quezon City, Pasig, Batangas, DepEd Pasay, Dasmariñas, Parañaque, Muntinlupa, Occidental Mindoro, Resu 8 of the Department of Health, the Gupan Doctors, Villaflor Memorial Hospital, Filanca in Subic Bay, Plaridel Infirmary in Bulacan, and so many more, Bohol, Rizal. Nako, kamusta sa inyo lahat, and thank you for being with us today. We are going to talk about are we ready for COVID vaccination? And we've got some very special guests with us. But before that, I would like to make a special announcement. And I think I turn over to TVUP on this announcement. I'd like to congratulate my co-host, Dr. Raymond Francis Sarmiento, who has just been awarded one of the 10 outstanding young men for 2020. Congratulations, Raymond. Sorry, Raymond, we couldn't help it eh. Pero bigyan nyo naman ng shot si Raymond para makita ang reaction niya. So, Raymond, congratulations. I'm sure your work on COVID is part of the award, being a Time awardee, and of course there's another Time awardee here in the on our show. We'll introduce him later. So anyway, over to you, Raymond.
Thank you, TVUP. I was pleasantly surprised with that, and thank you also to Dr. Susie. Anyway, as mentioned po, please join us and join our excellent panel of experts po to discuss the safety, the licensing, and how the vaccines will be accessed and brought here to the Philippines. Alam ko po marami pong mga katanungan with regards to local government units, private sector companies. Paano po ba sila magkakaroon po ng kakayahan na magkaroon ng pagkakataon na makapag-procure ng COVID-19 vaccine? So obviously, all of us really are working towards the recovery of everyone, not just health-wise, but also economic-wise and for all other aspects of our lives. And just to let you know, for those who are joining our webinar for the very first time, our sequence po, we have a resource speaker who will be providing the main discussion points for the webinar, followed by reactions from excellent speakers also and experts in their own rights. Then we will have a panel discussion, a Q&A with questions coming in from the public, and those will be entertained po, not just here in our Zoom webinar. I think we are almost at, we are now at 1,050 plus attendees. So maraming salamat po sa inyong panonood at pagtangkilik sa Stop COVID Deaths webinar series. Before we proceed, let me acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. It starts po with the University of the Philippines system, the University of the Philippines Office of the Vice President for Public Affairs, UP Manila, Office of the Chancellor, and Office of the National Institutes of Health Executive Director. Obviously, we at the National Telehealth Center are grateful for the opportunity to be part of this. This webinar also will not be possible without the help of and the support of our team over at the Information Technology and Development Center or ITDC. Doon naman po sa mga nanonood ng ating live streaming sa YouTube channel ng TVUP, which is the Internet Television Network of the University of the Philippines. Maraming salamat din po. And finally, our colleagues over at the University of the Philippines College of Medicine and the Philippine General Hospital. Dr. Susie?
Yeah, Raymond, I think we did have a couple of questions about the certificate. So maybe before we proceed, you could just brief everyone on the certificate.
Thank you. TVUP, may you, okay. So the one that you are seeing on the screen is really something of a duplicate or something that would resemble what you would be expecting to receive as an e-certificate. So for those who will be spending at least 50% of the time here in the Zoom webinar together with the presentations of our speakers, mabibigyan po kayo ng kopya na yon. So please stay tuned. Gaya po ng sabi natin, sana po ay kayo po ay nandito po sa webinar episode na to hanggang sa dulo po. And I think we have been distributing up until webinar 36, which was last week po, no? So for those who are listening in, tuning in, maybe watching the playback, please let us know if you think that you should be eligible or would have been eligible to receive an e-certificate. Please let us know if you did not receive one so we could check our records and get back to you as soon as possible. Dr. Susie?
Okay, thank you very much. So I know all of you wanted to hear from Eric Domingo, the Director General of the Food and Drug Administration, and he had in fact confirmed being here, but he's so in demand that he was called to a Senate hearing, but he did take time out to give us his opening remarks and to actually record his presentation. So let's have the opening remarks of Director General Enrique Domingo, Eric Domingo.
Good afternoon, everybody, or good morning, or good evening, depende po kung nasa ang parte kayo ng mundo. I would like to welcome everybody to this session and thank you for taking the time out. I know we have doctors, nurses, pharmacists, we have our therapists and mga scientists natin dyan, even hospital administrators and students joining us from everywhere. I'm sorry I cannot be with you live, as most of you know, meron na naman pong tinawag na session sa Senado at meron na naman pong hearing and I have to be there personally and physically present at the Senate. But it will not stop us from sharing information with you, especially with the COVID-19 vaccination that will happen very, very soon. Kung nakikinig po kayo sa balita, nakita nyo siguro kahapon ang ating news that the Philippines has been approved yung participation natin sa COVAX facility ng WHO. The COVAX facility is a way for countries not to pool resources and to have an equitable distribution of COVID-19 vaccines. So what it means for the Philippines na nakasama na tayo is that we will be part of this distribution process for vaccines that are approved by the WHO. And dahil po tayo ay low middle income country, actually libre po yung mga bakuna natin na matatanggap. We will get vaccines of about 40 million doses or about enough for 20 million or 20% of our population. Ngayon, kasama po dun sa mga criteria ng COVAX for a country to be included is of course the regulatory preparedness of the country for these new COVID-19 vaccines. And this will be what we're going to discuss later on, what the FDA is doing and what we will be continuing to do as we start rolling out this vaccination. Ngayon po talagang excited na tayong lahat sa pagbabakuna. Pero yung Pilipinas, ang National Task Force and the Department of Health is negotiating also with other vaccine providers or vaccine manufacturers. Because the 20%, of course, that the COVAX will be able to provide us within the year, hopefully yung start po within the first quarter of the year, will cover the health workers na 3%, plus the 70% would be yung high-risk population, the very elderly, people who are living in congested areas, people with comorbidities. But of course, the goal is really to vaccinate 50 to 70% of the population by the end of the year, so that we achieve some form of herd immunity and will help us slowly get back to the lives that we used to enjoy. Now, tayo po, marami talaga tayong kailangan pang gawin. The government is doing a lot of preparation, not only to regulate, but also, of course, to receive the vaccines, our cold chain facilities, yung logistics management natin. We're training now on surveillance and, of course, monitoring of people who will be vaccinated. We're also coordinating with the local government units up to the level of the barangay to make sure that this all goes well. And most of you who are listening here will probably be involved in this vaccination. So what we can do while waiting for that is really try to read up. Let's find out what the vaccination program will be like. Please attend all the webinars that you can, the town hall meetings that the Department of Health and the task force are organizing, so that we have an idea on what is coming, when it is coming, and how we will be doing it. Doon naman po sa inyong mga kaibigan, doon sa atin pong mga kasama sa komunidad na nagtatanong, ano bang kailangan natin gawin? Well, ako po, ang lagi kong ina-advise is let's ask them to read up on the vaccines. Meron po product information available online, mga vaccines na ma-approve natin for emergency use authorization in the country. And I would like everybody to start reading it. Para pagdating po ng panahon na tayo na nakapila dun sa bakuna station or the vaccine area, we will be given, of course, the information, and we're going to be given an informed consent. Nobody will be vaccinated without informed consent. And required po yun ng ating emergency use authorization, the full informed consent. So mag-prepare na po tayo ngayon pa lamang, magbasa na tayo, alamin na natin para pagdating po ng panahon na tayo na yung tatawagin for the vaccination, ready na tayo and we'll be able to make the proper decision for ourselves. So maraming salamat po. I hope you have a wonderful session. You learned a lot. After this session, the director for the Center of Drug Regulation and Research of FDA, Director Joyce Runay, will be here to answer questions that you have for FDA. Maraming salamat po.
Okay, thank you very much. That's Director General Eric Domingo, Undersecretary and Director General Eric Domingo. And we'll have somebody from the Food and Drug Administration later to answer all of your questions. So please put your questions in the Q&A box. And I'm still going to greet some people, or maybe Raymond, do you want to acknowledge the others who have just joined us from different places?
Okay, so those who have joined us, I'm just scrolling through the chat box. We have representatives po all the way from Negros Occidental. We also, I'm seeing here, well, Negros Oriental naman po ang sunod, from Bernardino General Hospital 1, from DepEd Manila Nurses. Yun po. So, maraming salamat po sa DepEd. Zamboanga City is also here. Marikina City, Morong Bataan, really a lot more. So maraming salamat po. We even have one from Moscow, Russia, if you can even believe it. So yun po ang ating list of attendees for today. And thank you for that tape message from Director General Eric Domingo of the Food and Drug Administration. But at this point, may we ask everyone to please take a few minutes for our fun opinion poll. May we ask TVUP to, okay, here we go. So, wala pong, ano po dito,
Great,
Opo, sa opinion poll po nito. So, if you get it wrong, then you just try again later on po. So, I'll just read the questions and hope you're, most of our now numbering 1,330 attendees will join us. So number one, the EUA means Emergency Use Authorization. Correct po ba yun o hindi? Is it a yes or a no? Number two, question states which of the following have an EUA from the FDA. So multiple choice po ito. Ang nakalagay po dito are the list of the vaccines. Number one, Pfizer. Number two, Moderna. Number three, AstraZeneca. Number four, Sinovac. Number five, Gamaleya. All of the above or none of the above. Finally, we have a very simple question. Are the vaccines already available in the Philippines? Siyempre, marami po tayo naririnig sa news, no? So, ano po ba sa tingin ninyo? Nandito na po ba siya or wala pa po? So, please key in your answers as I read the list of those who are joining us all the way from Bontoc Mountain Province, from Camarines Sur in Bicol, from Dumaguete in Central Visayas, from the Northern Mindanao Medical Center in Cagayan de Oro City, from the Sulu Provincial Hospital in Holos Sulu, from the Bangsamoro Autonomous Region in Muslim Mindanao. Internationally, we are also being viewed po. And as mentioned, we have one from Moscow, Russia, but we also have others from Southeast Asia po muna tayo, no? The Prestige Hospital in Phnom Penh, Cambodia, the Nang Teng Phong General Hospital in Singapore, Bethsaida Hospital in Tangerang, Indonesia, and Quassia Diagnostic in Bandar Seri, Begawan, Brunei. In the Middle East, we have the Al Masara Hospital, the Ministry of Health in Muscat, Oman, from Jeddah, Saudi Arabia, from Hamad Medical Corporation in Dubai, Qatar, and from Florence Home Care, Abu Dhabi in the United Arab Emirates. In the Northern American continent, we have Kennedy Lodge Long-Term Care from New York. We have representatives from Toronto, Ontario, Canada, and Niagara Falls. From the Ontario side, not the New York side. We have one from Everett, Washington in the United States and Cambridge, Massachusetts in the United States. Over across the pond naman po, we have one from the Chelsea and Westminster Hospital, London, England, the Fleet Postal Office in Diego Garcia, British Indian Ocean Territory of the United Kingdom, and then finally, the Australian National University from Canberra, Australia, another one po from Bahrain. So maraming salamat po sa patuloy po na pagtangkilik at panonood. I'll turn the floor over to Dr. Susie to start the ball rolling.
Okay, so I think, we've got lots of people watching from all over the country and all over the world, and I'm eager to know a little bit more about the preparedness of the Philippines for doing vaccination. I think, Raymond, last week we talked about, are you afraid of the variants? And we got some very clear answers there that we expect this virus to mutate. Currently, we don't see any effect of the variants on the vaccines. So the question now is, are we ready? Is the country ready? And some of the questions include, when is this going to happen? How is it going to happen? What are the LGUs going to do? What is the private sector going to do? And we're going to hear a little bit in our panel about how it's being done in another country, in the United States. And of course, we're going to hear from the Department of Health. We've got some very special guests for you. So without further ado, let us continue to listen to FDA Director General Eric Domingo.
So hello again, everybody. I'm back. Chancellor Menchit, Madam Susie, maraming salamat po sa pag-imbita niyo sa akin ulit. And I miss both of you, no? But unfortunately, nasa Senado tayo ngayon. I'm sure this is much more fun than what's happening there. But let me try my best to give everybody some explanation on what the FDA does and how regulation is important in this time of pandemic, and that now that we're going to start our COVID-19 vaccination, and of course what the FDA does. Let me just share my screen. There. So this is the mandate of the Food and Drug Administration. It's really to ensure safety, quality, and efficacy of health products. We want everybody to have access, equitable access to good quality products that will make us healthier, that will make us feel better. We do licensing, we register products, we do post-marketing surveillance, And this is like just a general classification of the products that we register. No? So any processed food goes through the FDA, drugs, cosmetics, medical devices, toys and childcare items, and even hazardous household substances, no? Things lying around the house like yung mga panlines, paints, and stuff like that. So to date, we have about 76,000 licensed facilities, establishments in the country. So halo-halo yan, from manufacturers to distributors, including radiation facilities under FDA yan, tsaka yung mga pharmacy ng mga hospital, for example, that also is under the purview of the FDA. And we have about 250,000 registered health products. Pinakamarami would be food and food supplements and cosmetics, no? Followed by drugs. For new products, the FDA regulates two things. Now, if we are trying to develop a product and we need evidence for regulatory requirements for registration, then you can apply to do a clinical trial, no, with FDA, and the FDA approves the clinical trial. Of course, we work with right now for COVID-19, we work with the vaccine expert panel of the DOST. They do a pre-screening of the vaccine candidates and the trial candidates, and then they pass it on to FDA for technical review. And then, of course, we have our ethics board reviews before we finally get to pursue trial, for COVID-19. And then, of course, we also register products. Ito na yung certificate of product registration as we know it, which is licensing a product to be sold and to be available commercially in the country. So right now, as of this week, we have 3 FDA-approved COVID-19 vaccine clinical trials in the Philippines. That the first one was that was approved was Janssen. That is the company owned by Johnson & Johnson. They're developing a vaccine for COVID-19. The second is Clover Pharmaceuticals. This is a partnership, non-Australian and Chinese partnership, working on their own vaccine. And Sinovac also has a clinical trial phase 3 going on here in the country. What we are possibly looking at is, of course, the WHO Solidarity Trial for Vaccines, where the Philippines was selected as one of the possible participants in the early phase of the trials. No? So hinihintay lang natin yan na siguro yung susunod na mag-apply sa atin ng clearance or ng approval sa FDA. Aside from that, of course, yung products talaga ang nire-register natin. Now, why do we always talk about the EUA? What is an EUA? EUA is some regulatory mechanism that we use to make products that are still under development available to the public so we can use them during the health crisis, during the health emergency. Yung current legislation kasi natin sa Pilipinas, yung FDA law, it presupposes that we're always in normal times. No? So kailangan ng isang produkto, completed lahat ng clinical studies, meaning complete yung phase 3 trial niya, and then it is registered, and then when it is registered, it's open and available to the commercially in the market. No? So wala tayong flexibility when it comes to emergencies. Ang mangyari, kung hintayin natin na magkaroon ng fully registered vaccine, that will probably take at least another year. No? Mga 2 years kasi talaga yung development at minimum. No? So that means we will only be able to vaccinate by 2023, or even later than that. So that will put us in a very difficult position and unable to respond to our current pandemic. So the FDA issues there are ways to make drugs available in the country during this pandemic. Number one, of course, is certificate of product registration, a full registration of a vaccine or pharmaceutical product, kung talagang complete na yung trials, tsaka lahat ng kanyang clinical data is ready and really convincing. Of course, that takes time. For drugs that are now part of the clinical trials for the treatment for COVID-19, we have expanded access. Outside of being part of the actual trial or the investigation, people can access them through the compassionate special permit. Dati ang CSP natin, ila-allow lang natin yan for cancer and HIV. But middle of last year, we included emerging infectious diseases like COVID-19. So we've had people who were able to access investigational products outside of the outside of the clinical trials. Kaya nakaka-request ang mga hospitals natin, no, ng remdesivir, for example. And then, of course, we also we also issued, no, this policy or process wherein a product can get a quick CPR if it's a drug for emergency use. Ito yung mga drugs na nakalista sa PISMID guidelines, no, for treatment of COVID-19, like mga lopinavir, ritonavir, mga tocilizumab, nung una nga pati mga hydroxychloroquine, no? Kasi nung nagkaubusan ito, these are old molecules. These are tried and tested and very well-known products but are now being repurposed for COVID-19. So nung masyadong maliit ang supply, we allowed other suppliers to come in, no, through a facilitated process so that they can get a limited CPR valid for 1 year. Ngayon, yung problem talaga natin yung vaccine kasi wala pa naman talagang CPR na vaccine. Wala pa naman yung ready na for registration na vaccine. And this is, let me just give you this. I'm sure most of you have seen this picture. No? So from the left side, discovery, that's a gray, up to the preclinical and then phase 1, phase 2, phase 3 trials. Usually, pag nagre-register tayo ng gamot, tatapusin natin yung phase 3, yung pink. And then, makakarating na tayo dito sa yellow part, the FDA product registration part. So dito na, magkakakuha na siya ngayon ng CPR kung na-approve siya. Meaning, the product will now be available for marketing. No? Pwede na siya commercially available. Ang problema nga, to complete phase 3 will probably take another year. And most of the leading, no, yung mga nauuna na mga product development natin na vaccine right now are here in the pink, but in the middle of the pink, meaning in the middle of phase 3. So hindi pa siya talaga eligible for product registration because there's still things that we have to know. We have to learn about the product. No? However, in this part, pwede na tayong mag-isip, pwede na ba natin siyang gamitin? Is there enough evidence to show that it will be useful to us? And then dito natin ngayon iisip at dito natin binabase yung decision natin to give an emergency use authorization. For example, the US FDA set it at you can apply for an EUA if 50% of your study subjects have gone through and have been monitored for at least 2 months. Yung Pfizer, for example, nag-apply yon on the second month nung kalahati nung kanilang 40,000 participants ay naka 2 months na at pinakita nila yung kanilang data. So emergency use authorization is a risk-based procedure for assessing an unlicensed vaccine. So these vaccines are not licensed. These are not registered. They are products under development. We use it during public health emergencies, either locally or international, no, pandemic. And of course, the aim is to make these drugs available faster to the people affected by the emergency. And it is based on what data is available to date. Kung ano yung available ngayon, no? Quality, safety, of course, and efficacy. Pero talagang malilimit natin kung ano yung alam natin as of now, maggagawa tayo ng decision doon. What are the eligibility criteria? These are set by WHO, no? Number 1, the disease might be very difficult to control and can cause an epidemic or pandemic. So present yan ngayon sa COVID-19. Second, there must be no products available that are registered. So wala pang available na vaccine for COVID-19, pwede tayong mag-isip ng emergency use authorization for vaccines under development. But even though they are still under development, quality must not be compromised. All of the manufacturers must comply with good manufacturing practice. No? Kailangan pa rin naman reliable at saka talagang repeatable. You know, yung every batch na gagawin niya, talagang magandang kalidad and it's the same vaccine that we're going to take. And we have to require the manufacturer to promise that they will complete development of the product. Hindi pwedeng ibibenta niya sa iyo ngayon, gagamitin mong EUA, tapos biglang tutupi siya, sabi niya, tapos na ako. Kailangan i-complete niya lahat ng phase 3 trials and go on to actual registration of the product, to full development. Now, kailangan meron tayong regulatory preparedness. In fact, yung COVAX facility na in-announce kaya kahapon na payagan ng Pilipinas na pasama sa COVAX and we will be a recipient of vaccines, one of the things that they checked was the regulatory capability and the regulatory preparedness of the country. Number one, you should have a law, no, or policy that permits EUA. Tayo nga dati, wala tayong ganung batas. Ang batas lang natin, full registration. There must be a pandemic preparedness plan. In our case, our national vaccination plan that acknowledges the use of EUA vaccines. No? At para mapabilis yung proseso ng pag-grant ng EUA, dapat meron tayong what we call reliance and recognition procedures, meaning that we consider with weight the regulatory decisions and evaluations of the stringent regulatory authorities from other countries or from the WHO itself. Pagkatapos doon, required din naman na alam din na prepared tayo na kung meron tayong ready na system to monitor the products once they are out there in the market. You have to have close monitoring and surveillance and a very good risk management plan for each and every vaccine, which we require sa mga applicants natin. So sabi ko nga dati, wala tayong batas for EUA. Hindi talaga prepared ang Pilipinas dyan. Ang FDA, wala siyang regulatory flexibility even in times of health emergencies. And we're working on a law, and bill that will help us obtain that flexibility when it is needed. But until then, ang meron tayo ngayon is an executive order signed by the President. It was signed on December 1, and it grants authority to the Director General of the FDA to issue emergency use authorization for COVID-19 drugs and vaccines. So this one is very particular and very limited in scope, only to COVID-19. Later on, we really will need some policy change on that will allow us more flexibility in times of any type of health emergency. So like I said, that EO was signed on December 1, 2020. We issued the guidelines on December 14, and then we started receiving applications then. So kung makikita po din nyo, yung nasa left side, yan yung dating, yan yung full registration diagram ng FDA. If you're going to register a new vaccine with the FDA, it used to take 6 months to almost a year. And then you have this so many steps, and then of course a lot of requirements. No? For the EUA, number one, we require muna that the candidate has at least an EUA already from the home country. A lot better kung meron siyang EUA from a stringent regulatory authority, like US FDA, UK, Canada, Japan, Singapore, Korea, ganyan, no? So, pag meron na siyang ganun, pwede na siyang mag-apply sa atin. We were able to decrease our requirements to the minimum to assure safety, efficacy, and quality, no? And then we trimmed it down to 21 days. So yung 21 days na yan ang goal natin, especially for EUA applications from companies that have EUAs already from other reliable na mga FDA counterpart natin. Kasi madaling reviewin pag gano'n. At saka alam natin, nakita na rin ng mga eksperto na tayo naman maaari nating that are reliable. So these are the conditions for the EUA in the Philippines. No? You should have all three conditions present. Kailangan 3 out of 3. Number 1, based on the current available data, it must be reasonable to believe that the vaccine may be effective in preventing COVID-19. So kailangan makita naman natin yung efficacy data niya na talagang makakatulong siya at makakabawas siya sa pagkalat ng COVID-19. Number 2, the known and potential benefits of the drug must outweigh the known and potential risks. So hindi lang yung efficacy, yun din kanyang safety. Kailangan mas matimbang yung benepisyo pag ginamit natin siya kaysa doon sa mga possible na risk at saka mga alam natin na risk. Since these products have been monitored for maybe a few months pa lang, alam naman natin merong mga adverse events. May malalagnatin, may magkakasakit, merong parang sumasakit ang ulo. Pero pag wala namang mga serious or very suspicious adverse events, then these are acceptable adverse events. Of course, there are potential side effects that we do not know yet. So kailangan yung benefit niya mas matimbang kaysa doon sa alam na natin na risk at saka doon sa mga possible pa na risk na lumabas as the development of the product continues. And of course, dapat wala pang available na approved na bakuna. Pag nagkaroon na ng approved na bakuna, then unti-unti, ma-phase out na yung mga EUA natin. Kasi doon na tayo sa fully developed vaccine. Yung EUA, pwedeng mag-apply yung pharmaceutical industry. For example, yung manufacturer, pwede rin yung kanyang importer, yung distributor niya sa Pilipinas, or if they have a local partner here, for example. But the government can also apply for an EUA. For example, there's a product that they want, pero wala talagang local counterpart. No? Then the government can apply for that, for an EUA for that vaccine. They must comply with GMP, like I said, and yun nga, yung undertaking to complete the development of the drug. Hindi tayo pwedeng mabilad, tapos aalis sila, titigil sila, titiklop. No? Kailangan tuloy-tuloy ang development of the drug. Kasi malalaman natin as they go along, if anything new comes up, if anything suspicious comes up, then we can adjust the way that we use the vaccine or stop it completely if necessary. So in evaluating the applications, the FDA will have the power to implement reliance and recognition. Ibig sabihin, pag meron siyang US FDA na EUA, we ask for the full EUA report, the evaluation, even the question and answer portion of that EUA and the application, so that we can take a look at it, our experts can take a look at it, para hindi na uulit-ulitin. So yung mga tirang tanong na lang, yun na lang ang matitira. And we can also recognize, of course, decisions by the WHO. So, ang nangyayari ngayon, kapag nag-apply sila sa akin, the application's lodged at my office. So, they have a requirement of a list of requirements ng documents, and we check if it's complete. If it's complete, then we go on with the evaluation. I divide it into two. The technical parts, those that deal with the quality, the production, stability of the product, go to our regulatory officers dito sa FDA. So, we have dedicated people who really just look at the COVID-19 vaccines right now. They check the factory, the GMP, and everything. And then the other part, the scientific safety and efficacy data, the trial data, I give to a panel of experts. So we have two expert panels composed of at least 5 members each. So meron infectious disease specialist, may immunologist, merong vaccine specialist, halo-halo sila, may epidemiologist. So at least 5 each yan. And then they are given time to review, and then they will ask questions and clarifications or additional documents from the proponent, babalik sa kanila, review agad, and then they make their recommendations. They then give the recommendations to me so that I can make a decision on the application, whether of course to approve or disapprove the application for the EUA. The EUA is only valid during the declared public health emergency. So pag nawala na yung pandemic or nawala na yung public health emergency declaration dito sa Pilipinas, then the EUAs will be phased out. And the thing about the EUA is, the Director General of the FDA has the discretion to revisit, review, revise, or revoke the EUA at any time. So anytime that we see any signals, kaya importante talaga yung ating surveillance mechanism. Anytime that we see any group of clustering, for example, or adverse events, or some suspicious adverse event, and then we talk to the WHO and our FDA counterparts, if they see something similar, we can always pause or stop the vaccination until further notice, until we've done our investigation. Or of course, decide to continue kung talagang wala namang safety issue. So with the concerned offices of the DOH, ito ngayon yung kahati, since it's an emergency use authorization, it's a product under development, the other responsibility of government when they use this product is to closely monitor. We have to have good surveillance of everybody who will be vaccinated. We have to make sure that everything is done according to the risk management plan, that the whole chain is respected, at hindi nasisira yung ating bakuna from the factory until the area ng vaccination. And of course, that the pharmacovigilance is very active, both by the company, by DOH, and by FDA. Lahat ng adverse events should be regularly reported. If it's severe or something really suspicious, should be reported to the DOH and FDA within 24 hours, so we can make quick assessments. And of course, at the level naman ng DOH at ng FDA, meron tayong mga adverse event committees that will investigate, ready to investigate and take a look at anything suspicious that might be happening. So just as to remind everybody, just to let everybody know, no, ito na yung mga nag-apply sa atin. Ang plano ng gobyerno talagang magbakuna para sa lahat ng Pilipino. No? And the plan is to vaccinate 50 to 70 million, no, within the year 2021. And we believe that, there's good reason to believe that we might be able to start vaccinations possibly as early as February, no, or very early in March. No? So malapit na yun, a few weeks na lamang yun. Hindi pwedeng gamitin ang bakuna sa Pilipinas hanggang walang EUA. No? Kailangan pa rin talagang, yun naman yung kaya minsan may mga feeling nila nanggigigil sa akin, no? Baka feeling nila mabagal or feeling nila wala tayong sense of urgency, but wala kasi talaga tayong pwedeng shortcut when it comes to efficacy and safety. We have to go through all the process properly, have our experts take a look at it, have our regulators make sure that this is a good quality product that is being brought to us. No? So talaga pong pag nakadaan naman siya doon at na-approve siya, then alam naman natin, no? I can assure you that many eyes looked at it and it's been deemed worthy of being used in our country. So ito yung mga nag-apply ngayon sa atin, no? Yung Pfizer-BioNTech. Yung Pfizer has actually EUAs in several countries with stringent regulatory authorities, no? Like US FDA sa UK, yung European Medicines Agency ng EU, sa Canada, sa Switzerland, no, Swissmed, Singapore, and it's the only one that has a WHO emergency use listing at this time. At siya rin naman talaga yung pinakaunang nag-apply. No? Nung before Christmas, nag-apply na yan sa FDA, and we actually granted already the EUA for Pfizer-BioNTech last week. Yung AstraZeneca, nag-apply na rin. They have an EUA from one stringent regulatory authority, which is United Kingdom. They also have EUAs from Argentina and India, but Argentina, India, Russia, China, these are not considered stringent regulatory authorities. So we cannot really rely upon them as heavily, no, as we rely upon the other stringent regulatory authorities. So si AstraZeneca applied after New Year, and this is now under evaluation. Our experts gave them a list of questions on Monday, and they promised to reply by today, Friday. So siguro by the weekend or next week magre-resume na ulit evaluation niyan. Si Gamaleya, this is the Sputnik vaccine from Russia, is under evaluation already. Our experts are ready preparing the list of questions for them for us to send to the proponent. Yung Sinovac, nag-apply na rin to last week, and then yesterday finally nag-submit na sila ng kanilang phase 3 trial. So ngayon pala mag-uumpisa yung evaluation niya. We don't want to start evaluation without interim phase 3 trials because that's really the basis of our decision. No? I mean, the safety and efficacy data from the interim trials, interim reports are talaga yun yung meatiest part. So pag wala yun, I don't even want to start the evaluation ng vaccine. In the horizon, we have a few that will also are asking na if they're going to for the process and the requirements katulad ng Moderna, Serum Institute of India. But Biotech actually already submitted an application yesterday, but we're still pre-screening it. Mukhang kulang pa. I think wala pa yung kanilang phase 3 trial. So hihinggan pa natin sila ng notice of deficiency. Si Janssen, yung sa Johnson & Johnson, Clover, Sinopharm. These are the front-running vaccines that we think might be applying for EUAs with us very soon. So just to give you an idea of what an EUA looks like and what how the product will be presented to you when it comes to you kung babakunahan na kayo or kung magbabakuna na kayo. These are the parang salient points lang nung Pfizer EUA. Number one, we gave the EUA because the 3 criteria were followed naman. The evidence shows that it is reasonable to believe that the vaccine is effective against COVID-19. The potential benefits outweigh the risk. And of course, there's still no currently available approved COVID-19 vaccine. So 3 out of 3, check yan. So na-approved na siya. Second, it is clear that the EUA is not a marketing authorization. It's not a certificate of product registration. Therefore, the EUA cannot be used to sell the product commercially. Hindi po siya maaaring ibenta. Hindi niyo siya pwedeng makita sa butika. Hindi siya pwedeng itinda-tinda, no, kahit saan. Pfizer is only allowed to supply to the response stakeholders, no? And that means the Department of Health and the National Task Force. Of course, the DOH and the NTF can designate authorized bodies to help them with their vaccination plan. For example, public and private hospitals, local government units. Hindi naman talaga tayo makakapagbakuna kung walang kasama mga LGU. So they can partner with these entities and then they can designate them so that they will also have access to the vaccine. But through the DOH, no? Hindi pwedeng dire-diretso kanya-kanya kasi hindi naman unlimited ang supply natin ng gamot. Pag yan pinagkanya-kanya mo na yan, ang hirap-hirap ng i-monitor, ang hirap ng bantayan, kung may magka-problema, hindi mo alam kung anong bakuna ang napunta kung kanino. And siyempre, yung kung sino yung may pera, siya yung mauuna. Baka mamaya, yung mga cities na mayayaman, Makati, Quezon City, 100% ng population nila vaccinated na. Pero yung mga 5th and 6th class municipalities na walang pera, wala nang aabot kasi wala nang mabili na bakuna ang DOH. So the deployment of the vaccines should always follow the national vaccination plan. Whether you're the government or the private sector or the LGU that is working with the DOH, kailangan lahat nakasunod pa rin sa national vaccination plan natin. And of course, yung isang natin, yung limitation ng Pfizer vaccine, it's only administered in individuals 16 years and older. So wala pa pong bakuna for kids. No? The clinical trials involving children younger than 16 or younger than 14 are just underway now. So wala pa talaga tayong vaccines for kids probably until the end of the year. No? So as of now, we're going to be vaccinating adults. So yung cold chain management, of course, that will be the responsibility of the company and of course, kung sino yung nakontrata sa kanya. If the DOA, depending on the terms of the contract with the Department of Health or the National Task Force, then they can share the responsibility for the cold chain management, but they always all have to follow the cold chain requirements of the vaccine. Especially the Pfizer vaccine is very, very sensitive. It's stored at -70 to -80. And once na ilabas mo na siya, it has a very, very short shelf life. Pharmacovigilance, there must be a comprehensive pharmacovigilance system. And this one is again shared equally by the manufacturer and the government. So when we say government, that means both DOH and FDA. Yung ating monitoring and surveillance dito is going to be very strict. And we're now rolling out training programs and we're using the VigiFlow system of WHO para madali ang pasok ng data sa FDA. And as naman, we can also upload it to the monitoring systems natin overseas. So we can compare and easily get feedback also from overseas, both locally, tapos pati international. Tuloy-tuloy yung yung ating communication system. And thus, kung tayo naman ang magbabakuna, no? Kung tayo yung vaccinator, tayo yung emergency provider or vaccination provider, we must always remember that administration of the vaccine must always be in accordance with the EUA, and that before we vaccinate, we have to participate and comply with the terms of training required by DOH vaccination program. Hindi po pwedeng kanya-kanya. No? All the vaccinees must be provided fact sheets and information sheets. So required yun dun sa EUA na merong fact sheet, no? Or product information sheet. This is available online. In the case of Pfizer, for example, kasi nga may EUA siya sa US, yung kanyang information sheet comes in different languages, including Filipino, kasi marami rin namang Pinoy doon, no? Including in Tagalog. No? So kailangan ma-provide ito sa mga vaccinees. Pagkatapos, we have to obtain written informed consent, full informed consent before vaccination. We cannot vaccinate without the informed consent, especially since this is an emergency use authorization vaccine. This is a vaccine under development. And we have to report any adverse events following immunization. Basta meron po tayo na pansin. So we're going to ask the patients to stay for 30 minutes to 1 hour to watch out for in case of Pfizer kasi one of the things that has been recently found out yung sa US nga is that nagkakaroon ng possible allergies and anaphylactic reaction. So kailangan bantayan natin 30 to 100. Tapos yung kung saan tayo magbabakuna should have facilities and supplies ready to manage a patient in case they become severely allergic or or develop anaphylaxis. So yun naman ang maganda sa EUA, kaya natin siyang i-revise continuously. Kamukha nung sa Norway na nag-vaccinate sila kasi talagang ang daming namamatay ng mga sobrang very senior citizens nila in the homes. No? They were like dying 400 a week. So even if they were very elderly, above the 85-year-old na naging part nung clinical trials ng Pfizer, they vaccinated everybody, including the very frail and the terminally ill. So within near the time of vaccination, there were like 23 reported deaths. No? So now, what they say, hindi nag-change ng vaccination protocol ang Norway, but they just adopted to say that if they're above 85, that you have to do a complete physical examination and maybe not give it to those who are very frail or who are already terminally ill. So yun ang EUA, no? It's very adaptable, and then we can change it guidance very, very quickly, and we can revise the conditions for use very quickly. And of course, like I said, the EUA will be only valid during the duration of the declared public health emergency, or when the company already gets a CPR, or kung may ibang company na makakuha na ng CPR na registered product, then lahat ng EUA is affected. So that's that's what an EUA is. These are the products that we'll be expecting to come to us. And ang advice ko lang sa lahat, while we're waiting to be called, please read up on the vaccines, find out what are the pros, what are the cons, what you can expect after vaccination, para po pag time na tayo na yung tatawagin, tapos pupunta na tayo dun sa ating vaccination center, meron tayong informed, makakabigay tayo ng informed consent dahil naiintindihan natin kung ano yung ating tatanggapin at kung ano yung mga possible na benefits nito at saka yung possible na mga adverse events nito. Maraming salamat po.
Thank you very much. That was Undersecretary and FDA Director General Eric Domingo. An excellent presentation, very clear. He's very calm and he's very credible. And I hope you learned as much as we have from his presentation, and we'll share this webinar because, sometimes we can't achieve understanding through sound bites or very brief interviews. No, there's really a need for some in-depth discussion, and he has explained the difference between the EUA and the CPR, and the very strict process that the FDA is using to make sure that we get safe vaccine. So I think transparency is really the name of the game here if we want people to trust in the government and to trust in the vaccination program. So Eric's not with us right now, but I'm very sure that your questions can be answered by the representative of the Food and Drug Administration who's here. Now we're going to our reactors, and I'd like to call on our first reactor, who is not new to you, certainly not new to me. I mean, I've been working with him for more than 30 years and have seen his leadership in the public health sector for such a long time. Very familiar person on social media with 16,000 followers. Director Eric Tayag. Eric, welcome to the webinar. He is the director of KMITS, and he's
Yeah,
going to tell
Susie. That's the
KMITS.
Knowledge Management Information Technology Service. Thank you,
Okay, and
Susie. Thank you, Raymond.
it looks like, is that the Austrian 3D version of
Uh,
SARS-CoV?
those are the red ones are the spike proteins of this virus. Yeah, it's supposed to represent the variant. Okay. I don't
Okay,
want to
wow.
scare people, but this is to
Okay.
remind everyone that there's still a pandemic. So despite the assurances that there's going to be a vaccine, even with a vaccine, public health measures should continue. And that should remind us that everyone should be careful. You should have your mask ready. There should be physical distancing. Okay. And all that matters is back to basics, washing your hands, and there's your alcohol. And of course, stay home if you have to. Thank you, Susie.
Okay. Eric, what's your reaction to the presentation?
Okay, that was an excellent presentation. The origins of the emergency use authorization was based on the fact that there is a public health emergency. If everyone will recall, the president in his announcements in this pandemic, that's up to September 12 this year, is the declaration of the state of calamity. So we're still in the public health emergency. We have reached over 500,000 cases, and we are looking at the possible impact of the variant SARS-CoV-2 strain. So those things are very important when we deploy the vaccine. The second one is that DG Eric mentioned that the expert panel was able to make an analysis and that the benefits outweigh the risk. That's why they went on to provide the emergency use authorization as DG has explained. And of course, because it's an emergency use authorization, hindi po tayo lahat mababakunahan ng sabay-sabay. Forget it. The noise about LGUs with their advance orders merits the understanding of the EUA. Meron lang vulnerable individuals na mauuna. Emergency nga eh. Kaya dahil sa emergency siya, it's the healthcare workers that were prioritized, and then it's the senior citizens, and then the indigents. That's why we're working very closely, Susie, Raymond, with local government units because before vaccination happens in our country, it is important that we are able to get a master list of all these individuals that are going to be prioritized. We're going to register all vaccine facilities because they have to show that they will conform to standards when these vaccines are actually provided in their facilities. And three, that there are vaccination teams well trained and that they will be up to the task of providing the vaccines to Filipinos. In fact, including an important period during vaccination wherein you have to stay for at least 30 minutes to 1 hour so that you can be monitored for immediate side effects. What's very telling about DJ Eric's presentation is that they have shortened the process. Okay. There are several vaccines on queue that may be given also emergency use authorization. So the implications are we're not going to use just one vaccine, but the potential use of multiple vaccines. Not only will that require specific logistic arrangements, but that will also require the correct information so that those who will vaccinate will know the exact procedure for these different vaccines. I shudder at the thought that mistakes or errors may happen, and I hope this will not happen because of the multiple vaccines that will be available. Now, he mentioned that we should read on these vaccines because it's available. One caution though, a little knowledge may be a dangerous thing because if there's not somebody who can help you interpret what you read, it can be easily misinterpreted. So, for example, you read something that it's 50% efficacious, then you cannot translate this to the actual vaccination because this time we're going to measure vaccine effectiveness rather than vaccine efficacy. And a 50% efficacy doesn't mean you'll just be protected 50% of the time. It means that there will be anticipated 50% reduction in infections among those who get vaccinated. So this should be explained very well. While you might read something about these vaccines, your mind, your beliefs will influence what you think is what you understood about these vaccines when you read articles from journals or even information from different sources. Thank you, Susie. Thank you, Raymond.
Thank you very much. That was Director Eric Tayag with his reaction on the presentation of USEC and Director General Eric Domingo. Okay, now we have also very familiar person that you've been seeing also on television and in media, and I'm very honored and proud to introduce our next reactor, who comes from the private sector and will give us his take on the role of the private sector, how the private sector is preparing. Remember, our topic is, are we prepared for COVID-19 vaccine? So let me introduce Paolo Maximo Borromeo, the President and CEO of Ayala Healthcare. Paolo, welcome to the webinar.
Hi, Susie. Good afternoon, and good afternoon to Chancellor Menchit and the rest of the UP community. I'm happy to be here, Susie.
Okay, so Paolo, what's the plan in the private sector? How are you preparing for vaccination? What are your main objectives? What are challenges that you're facing?
Well, first, Doc Susie, let me react to USEC Eric's fantastic presentation, which I thought explained it very well. I just wanted to say that there was a phase maybe a few weeks ago during the Senate hearings where people were trying to question the EUA. And DG Eric was actually answering it very well. But I think there was a lot of debate because there was a suggestion that they should open up the procurement process of vaccines to the private sector, if you remember that. And Director General Eric was arguing, we think correctly, that hindi po pwede. Right? Kasi kaya po tayo nag-EUA is para ma-accelerate ang process, but an EUA is not a license to procure or to sell directly from manufacturers. No? The essential concept of an EUA is it's for governments, the national government, to be able to use. And so when they were having that debate amongst the private sector, especially within our group, our general sentiment was tama po ang gobyerno. Right? Because we are in a situation where there is really just limited global supply. No, of course, if given the choice, of course we would love to be able to procure for ourselves directly. No, but I was explaining to people who would care to listen that there were many reasons why it made more sense for the national government to procure directly, and the EUA is mistakenly used as either the reason or the factor on why private sector cannot procure. No, but the real reason why national governments should be the ones procuring in this phase where there is limited supply is really both a policy and an economic reason. No, policy because someone has to be prioritizing and determining the guidelines on how these things will be, how the vaccines will be allocated and distributed. No, hindi naman po pwedeng kung sino-sino na lang. Otherwise, that will be extremely chaotic. So someone has to be setting the guidelines. Right, and that's really government's job. But secondly, and most importantly, there is an economic reason why governments need to be procuring in this particular phase, not the private sector, not anyone else, not the LGUs. It's because we have to have a consolidated, large enough pool. Economics lang po naman yan, di ba? Supply and demand. There's limited supply, right, and there's such great demand. And so, to be frank, Susie, we tried, right? And many private sector companies tried to procure. Hindi po, unang-una, hindi po talaga pwede because of our laws. But pangalawa, hindi na naman tayo pinapansin. Right? I mean, if I order, it's too small a requirement that, manufacturers really would say, sorry, we'd rather talk to the government. Right? Because from our perspective, I'm Pfizer, I'm looking at Malaysia, Indonesia, the Philippines, Thailand, and trying to figure out how to allocate my limited supply to those countries. Right? So you need to be talking to me in tens or hundreds of millions of doses, not in 10,000s of doses. Diba? So there really is a benefit to going through the public sector. And I remember Director General Eric was arguing for that in the Senate hearing. But we all, it was just politicized, I guess, but we really realized in this particular phase, everything needs to go through the government. The EUA is an enabler, but it is not meant to restrict the private sector, right? In fact, it was meant for government to be able to procure quickly. But the right thing to do is to coordinate everything with the public sector and the national government today. So on that note, Susie, from the private sector's perspective, we are all out supporting Secretary Charlie, DG Eric, Secretary Duque. In the IATF, we have a joint public-private sector collaboration. We have organized into different work streams. So meron procurement work stream, my administration work stream, my distribution work stream, my communications work stream. Very fortunate to have Director Tayag there too, as well as other familiar faces here on the panel that I see. And we're all jointly working together across those work streams. For us, I think as a private sector, there are a few things that we are pushing for. Of course, the availment and the procurement of these vaccines in the soonest possible time. So wherever we can help facilitate discussions, whether it's with AstraZeneca, as Go Negosyo helped out on, or with Moderna, which is what the private sector is helping out on right now, or even with Pfizer and J&J, para lang tumuloy-tuloy, no, tsaka umabante yung mga usapan, we are providing support there. Pangalawa, in terms of the distribution, we are also, of course, helping ensure that we have the right supplies, the right logistics providers, the right cold chain facilities. And so where we can, many people have volunteered already to help out. But people have coalesced around different work streams, particularly on the distribution and logistics side, so that we can ensure that the products are delivered accordingly. In the administration side, Susie, happy to say that there's really joint collaboration there. There was the PASIG simulation that was just done, and I know the private sector and the public sector worked on that together. Hindi po kasi talaga kakayanin ng public sector, no, sa administrasyon. Meaning, I think the number in PASIG when they were baselining it was they needed 40 administration sites, no, just in PASIG alone. And if I remember correctly, there are 3 public hospitals in Pasig and 15 private hospitals in Pasig. So first and foremost, you need the private hospitals. And secondly, you need more than the public and the private hospitals to be able to administer or to get to 40 sites. So kailangan po talaga tulong-tulungan. So lahat po kami nagboboluntaryo. Kami po, we have volunteered and are participating very proactively so that our hospitals, our Qualimed hospitals, our healthway clinics, at kung ano pa pong sites, no, kung kailangan ng mga malls or mga eskwela na pwedeng gamitin pang bakuna or as vaccination centers, we would be happy to volunteer those. And of course, our doctors and our nurses, I hope some of whom are here on your webinar, Susie, of course, are also part of the community that we are able to provide, no, in terms of vaccination help for the public sector. No. So yun na po, I think I'd like to say that on our side, we're hand in hand with the government in preparing for the rollout, in procuring vaccines. Mga bali-balita na private sector or LGUs are procuring directly, there is no truth to that. Everything is in collaboration with the government. Any procurement that you see is always in collaboration with the government. Now, of course, may mga haka-haka na may black market dito, na may smuggled goods. Hindi ko po alam yun. Pero kami po, anything that we procure or anything that any of the large groups procure is hand in hand with a tripartite agreement with the government. But I guess my last point lang, Susie, is aside from helping the government, of course, our agenda as private sector groups, such as the Ayala Group, is for us to be able to help our own populations. No? And we realize that vaccination is the first step towards recovery and towards normalcy. And we are allocating a huge amount of money. I think in our case, we're forecasting about $15 to $20 million para lang mabakunahan mga empleyado namin. around our entire group. No? And we are willing to do that kasi po sa amin, our employees are the heart and soul of the organization. And so to us, it's very important that we provide them all the access that we can, to COVID-19 vaccines.
Okay, thank you very much, Paolo, and thank you so much for your time. I mean, I think it's very reassuring to hear the spirit of collaboration and cooperation of the private sector with the government, and your own belief that we really have to have a single, parang dapat may kumukumpas, no? And it really has to be the government. We cannot, hindi pwedeng magkanya-kanya, no? In this time of emergency. So thank you so much for that. And we're really looking forward to hearing more about what you will be doing in the future. So I'm going to turn over to Raymond, who, our new TOIM awardee, who's going to introduce another TOIM awardee. So Raymond, please introduce our next reactor.
Thank you, Dr. Susie. I just wanted to reiterate also the need and the value that we are placing on a centralized, coordinated effort so that everyone, all of the sectors that are involved really has a hand as we all work towards having a whole of society approach in fighting COVID-19. So before I spill over to my dialogue, may I introduce Roby Alampay, who is the co-anchor of the Chiefs on TV51 News and also the founder and CEO of PumaPodcast. Roby, good afternoon. How are you?
Hi, good afternoon. Hi. Can you hear me? Okay naman yung audio natin?
Yes.
Okay.
Go ahead and give your
Sige.
reaction to the talks already.
This will not be long. Maraming salamat po for having me here. I will gladly defer, of course, to everybody who already knows and are the real experts and leaders when it comes to the technical aspects and the science and the research and the facts and the truth when it comes to vaccine. Clearly, I'm part of media, and so that is not my expertise. If there's anything, when I was invited to be a reactor here, I was expecting to be a moderator. That's usually what I'm asked to do. Pero sabi nila Susie, nila Vice President Pernia, hindi, reactor. So I said, look, what can I contribute? And in all modesty, my entire life has been about information. My entire life has been about communication. And that's where I want to limit my reaction. We always say that information saves lives. And at that, I personally have always had that conceit as well. And I've always also wanted to believe that the people who put forward information, whether they're from government or the private sector or civil society, people who push information are frontliners as well. And I think it won't be a surprise to everyone. And if there's anything that I hope the media has a real and legitimate pulse on, is that the public ironically feels that when it comes to the information upon which their lives will depend and their actions will depend, it's ironically where they find a lot of, let's just say, dissonance. That's not quite how journalists and columnists and media writers will put it. That's putting it very mildly. But I think you know what we're talking about. And that's our concern moving forward. Because when we talk to scientists, and many of the panelists here, we've guested on One News, we've guested on the Chiefs, we've guested on Signal. Some of the panelists here we've gotten on the podcast that we've been developing with PumaPodcast. We're developing in partnership with some NGOs and some development agencies, some audio content that can be distributed to barangays, that can be distributed to community radio, and so on. But our concern always, and one of the things that we recognize, is that when we talk to scientists, we are by and large always reassured. When we talk to technical people, we and the public are by and large reassured. The communication has gotten better. The communication skills of technical people have gotten much better. And for that matter, the data is starting to come in and everything goes smoothly until you get some statement. I mean, let's say it. You get some statement from Malacanang, and all of a sudden, we are either confronted with something that is totally jarring, or that for whatever reason people tiptoe around, right? So it becomes a dilemma for media in particular, when on the one hand we want to keep our officials accountable, whether they say something right or especially if they say something wrong. When President Duterte jokes, and we'll acknowledge it's a joke, but when President Duterte jokes or quips, for example, lightheartedly na, di kung wala kayong alcohol, magugas ka ng kamay sa gasolinahan. You know, it's a real dilemma for media that wants to amplify the correct messages, but at the same time wants to hold our public leaders accountable. Because on the one hand, we have to put it out there that this dangerous line has come from our leaders. At the same time, we're amplifying something that is wrong, that even media cannot run after. Even media cannot run after fake news. We can invest in fact-checking operations and so on, but any media practitioner involved in digital can tell you, the analytics will tell you that the fact-checking will never reach the level of the original virality of the fake information. And so where we really should be investing is in proactive education and information campaigns. And yet we are constantly distracted. In everything that I'm saying, I'm also acknowledging that media is part of the problem. So this is not just about government leaders being given to statements that are not backed up by science and facts and data, but it's also fueled by, as I said, that dual role of media, and at the same time, a real editorial prerogative that very often we do not practice. When we know, for example, that somebody is joking and he does not mean it, or he or she has said something that is wrong, are we in fact really obligated to put that out there? Or do we in fact tell ourselves, look, we're the gatekeepers of information, we are, and therefore we have every right to ignore, even if that were the president, even if that were a top official. We should be within our rights to exercise that responsibility, to be gatekeepers and to ignore information when we know it can be dangerous. But what do we do when, for example, and this is the latest iteration of maghugas ng kamay sa gasolinahan, when the president trying to justify the lack of transparency on the matter of Chinese vaccines, when the president says, huwag na kayong mag-alala because kasing galing lang naman ng mga Chinese, ng mga Americans at saka mga Europeans. Yung efficacy naman ng Chinese vaccines, pareho lang. Diba? And we know for a fact that that's categorically not true. Diba? And yet, we have to broadcast that, one, because we don't have a choice. It's live, we're already streaming. And then after the fact, again, the matter of how do we put this on record so there is accountability down the line, it becomes a real dilemma. Now, how do we solve that dilemma? Ultimately, the objective is to create an information resilient population, right? And sinabi ni Director Domingo, magbasa na tayo. Let's start informing ourselves. Andyan ang mga materyales. The bad news is that kahit nandyan yung materyales, most of our people will never see that. And the bad news too is that if you leave it to them, they will not read it. Not everybody reads. And I'll also echo what Dr. Tayag said. The other reality too is a little knowledge can go a very long way in the wrong direction. So what's the latest that they did read? The latest that they did read, for example, is that may namatay na mga elders sa Norway. People can go to town with that. People can so much fear and anxiety and paranoia with that one line, and never bother to even hear the follow-ups, the whatever qualifications and the final scientific findings from Norway and EU and WHO and so on. So what's the solution? I think one of the things that we can look at is that at the end of the day, the resilience, the information resilience of our people has to be carried out at the ground level. It is actually the digital platforms and the social platforms are well enough in serving up um, the reliable information that people can act on. But what is really insulated from fake news are the old, not just traditional, but old and harder methods of information and education. Gathering people in town, ironically, gathering people in barangay halls, having flyers, having physical interaction, door-to-door campaigns on the level of our villages, engaging perhaps neighborhood association, villages, and so on, pamphleting. All of these are not sexy. All of these are hard. And we thought that we had emerged into a utopia where we don't need to go physically and door to door and meet people face to face. But the reality is that utopia is dystopian, right? We have seen the downside and the risks and the dangers of just telling people even to just follow us on social media or just see what you can get online. All of this goes to really, as I said, making people resilient in their information, making people information resilient, not just resilient against the vaccine, against a virus, but resilient against misinformation. And I think we have to go back to those old tactics. There has to be a huge investment in how do we get down to the communities, to the barangays, to the urban poor communities, to neighborhoods, to fisher folk, to people who may not platforms that we have. No? How do we get to community radio? How do we get to, for that matter, to the schools, to the marketplaces, and so on? And those are things that we have to put into the equation because right now, let's face it, the biggest purveyors of news are caught either in dilemmas of their own mandates, or they are, frankly, just risks to proper information. We're talking about, ironically, government at its highest level and media with that dilemma on how do we hold people accountable without amplifying the wrong information of the most influential people in this land. So all of that has to be involved, but I guess that's my message. Let's not forget the real hard work that has to happen down the line. We talk about giving people informed, making people have informed, giving them informed consent, empowering them to give informed consent. And I don't think that will happen uh, uh, on either side of those words. They will not either give their consent or they will not be informed unless this entire package and strategy for information education is carried out and taken out of where it exclusively resides, which is the digital world and the airwaves. It has to go back down to the communities because right now those are the only platforms that are completely insulated from fake news.
Okay, thank you very much. That's Roby Alampay, who you see on television, you read what he writes. And I just want to acknowledge the, what should I say, this painful dilemma that he's talking about that we all face. And I guess it's the Philippines and it's other countries as well, where there is a lot of dissonance and a lot of disinformation. And indeed, we have to sort of take the bull by the horns on some of these issues. And I'm glad you've raised these issues because we can't keep dancing around it. I think we need to see how that can be, how these can be truly addressed, because it can't be that we're doing one effort on one end and it's being negated on another front. But how do we achieve that? And you've talked about information resilience, which I think is a very important concept for us in public health communication. So thank you for that intervention. And I think we'll have, I mean, you've got a lot of responses on the chat box, Robbie. So you can see what people were saying when you were talking about this. Your message resonates with a lot of people in the audience. Now we've got a final reactor. We would like to call on somebody who is currently in the United States. Uh, we'd like to call Dr. Franco Felizarta, who's an infectious disease and internal medicine specialist. He practices in 5 hospitals in California: the Adventist Bakersville Memorial Hospital, Mercy and Heart Hospital. And we called him because we wanted to get a sense of what it feels like to be vaccinated. No, I'm joking. Franco and I had this conversation earlier about how the program, how the vaccination of health workers is going in a place like California, where we know we are hearing about thousands of deaths and so on. So, Franco, please give your short take on how it's been for you. You got vaccinated already, and what is the system? What are your concerns? And maybe how are the Filipinos in California? Go ahead.
Magandang hapon po sa inyong lahat, especially mga kababayan ko sa Mauban, Quezon. Thank you for inviting me to this webinar program. As mentioned, I'm an infectious disease specialist in a private practice. I have 6 employees. My task really for today is to share my experience with the COVID-19 vaccine rollout in my community in Bakersfield, California. Yung Bakersfield, California, it's located in Central California between LA and San Francisco. So now we actually have 2 vaccines that are available under the EUA, and that's emergency use authorization. So hindi po ito full approval. So Pfizer received their authorization on December 11, and Moderna received their authorization in December 18. The US vaccine rollout started on December 14, 2020. Ang rollout ho sa United States is in 2 phases. So the first phase is for healthcare workers like me, essential workers, 50 years and older, and 16 years and older with underlying medical conditions. Phase 1 ho yan. Phase 1 would be up to May of 2021. So starting May onwards will be phase 2. That's for 16 to 49 years old without underlying medical conditions. So for 15 years and below, it's not recommended yet because the studies are ongoing right now for children and for adolescents. So phase 1, there's 3 subphases. So there's phase 1A, 1B, and 1C. Okay, so 1A is for healthcare workers and nursing home residents. So right now there's about 21 million healthcare workers in the United States, about 3 million nursing home residents. So right now there are about 15 million Americans who receive the vaccine, at least 1 dose of the vaccine, either Moderna or Pfizer. 15 million Americans, and out of that, 13 million are healthcare workers, and 2 million are from nursing homes. So we already allocated actually about 30 million. So we're on the 50. We're using 50% of the allocation right now. So that's phase 1A. For phase 1B will be 65 years and older. Phase 1C will be 50 years and older, and 16 years and older with underlying medical conditions. So yung mga matatanda po, yung talaga mauuna na ma-vaccinate. So bakit po? So really, because COVID-19 follows the Gompertz law of mortality. Gompertz, the Gompertz. Gompertz law of mortality is there's a 10% increase in the mortality rate for every year. So it doubles, the mortality rate doubles every 7-year difference. So for example, a 90-year-old individual, if they are infected with COVID-19 or SARS-CoV-2, 90-year-old, the chance of dying is 20%, 2 in 10. Versus a 20-year-old, the chance of dying if it's infected with COVID-19 will be 0.02%. That's 2 in 10,000. So 90-year-old is 2 out of 10, 20-year-old is 2 out of 10,000. That's a 1,000-fold difference. So malaki ho pagkakaiba ng matanda at saka bata. So you really have to, dapat ho talaga mauna mga matatanda. Now, they've been mentioning about the deaths in Norway. So let me state the facts. There's 23 deaths out of 20,000 that were vaccinated. So that's 1 in 1,000. Okay, 1 in 1,000 died. And most of these patients are 85 and above. Okay. How about those patients who were not vaccinated? Yes, so there were 140, in Norway, there's 140,000 people in the nursing homes, 140,000. How many dies every week? 400. So that's 6 in 1,000. So if they were vaccinated, 1 in 1,000 died. If they were not vaccinated, 6 in 1,000 died. So mas mataas yun. And remember, if you're 90-year-old, if you're infected with COVID-19, 2 in 10 will die. So mas mataas talaga. So anyway, I received my Pfizer, my first dose of vaccine on December 21. And then my second dose of the Pfizer vaccine on January 13. So for Pfizer, the spacing of the first and second dose is 3 weeks. 3 weeks for Pfizer. Now, I was invited to get the vaccine by 3 hospitals. I work in 4 and actually 5 hospitals. So nakalimutan ko na sa dami. So I was invited in 3 hospitals, and I have to accept one invitation, and then I have to schedule online. So I have to use my smartphone. Ang problema nga lang ho sa smartphone, dapat yung gumagamit smart din. So ako tumawag na lang to get an appointment. So now, why do we have to make an appointment? Bakit hindi na lang pumila? So really the vaccine, the Pfizer vaccine distribution is a logistical nightmare. Bakit? So first, you have to store the vaccine in a -70 freezer, parang on dry ice, -70. If you take it out from the freezer and you put it in the refrigerator, it will only last for 5 days. If you take it out from the refrigerator, it will last for 2 hours before you can reconstitute it with saline. After reconstitution, it will last 6 hours. Ito ang problema. They are not 1-dose vials. There's 5 doses per vial. So actually, if you use a low dead volume syringe, you can actually get 6 or 7. So if you open up a Pfizer vial, you better have 5 to 7 people in front of you. Moderna is better because Moderna can be stored in -20. It's a freezer. You can take it out, put it in a refrigerator, which is about 30 days. It can last 30 days in refrigerator. If you take it out, you don't have to do reconstitution, but you have to use it for 6 hours. Ang problema sa Moderna is 1 vial has 10 doses, 10 to 11, depending on the syringe. If you have a dead volume syringe, you can get 11. So if you open up a Moderna vaccine, you better have 10 people in front of you. Not only that, you have to be monitored for at least 15 minutes after the vaccination to look for anaphylaxis or severe allergy. And if you have a history of severe allergy, you have to be monitored for 30 minutes. So the rate of severe allergy or anaphylaxis with Pfizer is 1 in 100,000. 1 in 100,000. The flu vaccine is 1 in a million. So it's 10 times, the rate of severe allergy with the Pfizer vaccine is 10 times the flu vaccine. But remember, if you are 90-year-old and you're infected with COVID, your chance of dying is 20%. And if you're 20-year-old, your chance of dying is 2 in 10,000. That's still much lower than the 1 in 100,000 of severe anaphylaxis. So anyway, my wife, Ceci, also got a vaccine, the Moderna vaccine, and she's a nurse. She's also the study coordinator for my clinical trial. She's really the boss of the clinic. But we've done about 170 multi-center international clinical trials for HIV, Hep C, and Hep B. Right now, we're doing multiple COVID trials, and we're actually a site for the National Institute of Health. It's the active 2 site. And so really, my staff has to be vaccinated because of the constant exposure to COVID-19. So my wife got Moderna vaccine 3 weeks ago. She'll get another one 1 week from now. So for Moderna, the spacing is longer. You need 4 weeks. Pfizer, 3 weeks. She got it from a community health center. The rest of my staff got it from a community health center or pharmacy. The vaccine is free. Libre ho ang vaccine. But if you go to a pharmacy, you're going to have to pay $25 for the administration fee. The original plan was for the hospitals to give the vaccine to all healthcare workers. And the pharmacy will give the vaccine to the nursing home residents. Pero hindi makaya ng hospitals. Why? Because we have a surge right now, an ongoing surge right now in the whole of the United States. 130,000 hospitalized, 25,000 ICU out of 50,000. That's 50%. 50% of the ICU beds in the whole United States are COVID-19. The worst influenza season does not cross the 4% barrier. This is 50%, 8,000 in the intubated. So in Bakersfield alone, we have 500 to 1,000 cases per day for the last 7 weeks. So I've seen about 250, just last year, I've seen about 250 COVID patients, 50 deaths. I had 50 deaths last year. Flu, 1 per year. Already have 50 deaths last year. That's 50 times worse. And we're not even finished yet. Remember, COVID-19 will infect 70% of the population. United States right now, we're not even 25%. So talagang the hospitals have a hard time. We're really busy in treating COVID-19 patients. They don't even have the staff, extra staff to vaccinate the healthcare workers. So we need to have the help of the community health centers, the private clinics, and the pharmacies. So I think my time is up. So if you have any questions, you can ask me any questions about the side effects during the panel discussion or question and answer.
Thank you very much, Dr. Franco. Thank you so much for joining us. I know it's a little late where you are, but I think it's very nice to have another perspective. And I think in the panel discussion, maybe we can talk a little bit more about how things could have been better or prevented. Okay, we're going to call everyone in now into the panel, and let me call on Director Joyce Sirunay, who will be answering questions on behalf of Eric Domingo. If there are questions on the FDA side, Dr. Enrique Tayag, Dr. Franco Felizarta, Roby Alampay, Paolo Borromeo. We all have you here now in front of us, and we're going to start with some questions from the audience. So Raymond, take it away.
Thank you, Dr. Susie. I'd like to direct the first 2 questions to our DOH and FDA representatives. The question is about precautions and contraindications for people who have already recovered from COVID-19? Pwede pa po daw ba silang bigyan ng vaccine? Yun po ang katanungan from Daphne Bice.
Okay,
Either
the
Director
latest,
Joyce
yeah,
or
the
Dr.
latest
Tayag.
information we have is that those who are recovering from COVID-19 infection, they have to delay receiving the vaccination. And there's information that this should be at least 6 months. Whether or not this recommendation will stay, we have to follow this up with the SAGE recommendations. Thank you.
Can I make a comment on that?
Go ahead. Go
Thank
ahead.
you, Dr. Tayag.
Sure.
Dr. Felizarta, go ahead.
So in the Pfizer study, there were 1,747 patients in the vaccine arm that were positive for the antibody. So they already had COVID-19 and they still were vaccinated. And in the placebo arm, there's about 1,800 who were positive. So one out of the vaccinated patients, these are seropositive. These patients already had COVID-19. Okay. When they were vaccinated, one developed COVID-19. If they were not vaccinated, seven out of 1,800 developed COVID-19. So reinfection is not uncommon. And if you look at this data, the Pfizer vaccine actually decreased. It's we're talking about low numbers. So that's 1 versus 7. So that's still much lower. So second is in the United States, the recommendation is there's minimum criteria, but you can wait 90 days. The reason for that is the half-life of the antibodies is 90 days. And the reinfection rate is very rare within the 90 days. Thank you.
Okay, I just want to add information that we're not only using potentially Pfizer, but other vaccines as well. And so while we have this information, such policies will be evaluated, and that there will be announcements if those who had COVID can actually receive the vaccine. Thank you.
Okay,
Thank you,
Raymond, let's pick
Director
up
Joyce.
another question from the audience. Go ahead.
Okay, so I'd like one of the questions, not really upvoted, but I'd like to ask Paolo Borromeo. Paolo, you are really on the forefront of this in terms of the procurement. You understand and know that there are local government units and private companies who have chosen their own, let's say, preference for the vaccine. So take us through how potentially for Ayala Healthcare in particular, how Ayala Healthcare arrived at choosing a particular vaccine. And is there really a clear preference, or is your strategy more of getting the most number of vaccines that you could possibly get a hand on?
No. Well, first, Raymond, our goal is to get vaccines for our employees and our dependents, right? That's the primary objective. We of course get input from the same sources, from the DOH, from the vaccine expert panel, and we look to them for their advice. But we also have an entire public health and clinical team, medical team, looking at global research. Some of it Franco had mentioned earlier. So we have our own points of view. So from there, we've targeted a portfolio of products, the same thing that Secretary Charlie is doing for the country. And actually, we align very much with the government. But for us, we've defined, I think, 3 or 4 vaccines that we would like to be able to get for our group, ideally. Of course, umaasa rin kami sa gobyerno at sa LGU for many of our staff and contractors and agencies that within their own local governments that they are able to get access to it. But in parallel, we're also ensuring or trying to see how we can help our employees. Now, more than that, I think the private sector, where we really can, is to try to augment. It's not to replicate. It's not to cannibalize. It's really to augment to add on, not to government orders. So in particular, the Moderna procurement that Secretary Charlie is organizing, there's a base volume that government is negotiating for, and then we're all adding on to it. In doing so, we get more volume and more people vaccinated for the country.
Yeah, thank you very much, Paolo. I've got a question also, and I'm not sure who wants to answer this, but we've got a lot of health workers in the audience. So as you can see, from all over the country, we've got health workers from hospitals and so on. So what's going to be the protocol? And maybe Franco, you might have some ideas on this. What's going to be the protocol on testing for health workers once vaccination has started? So I think some of our hospitals are doing regular testing for health workers. Once we vaccinate, do we still have to do testing?
Well, yeah. There's really no recommendation for testing after vaccination because at least for Pfizer and Moderna, they're 95% effective. Now, the problem with antibody testing is, remember the Pfizer and Moderna, at least for Pfizer and Moderna, they're mRNA, and these are instructions for the anti-spike protein. So in order for you to know that you actually had immunity against the COVID-19, you need to make sure that the antibody test is against the anti-spike protein. Because some of the antibody tests right now in circulation is anti-nucleocapsid. So actually, it's a nice way of actually differentiating between natural infection and vaccination. Because if you were vaccinated with, at least with Moderna vaccine, and you become positive with the nucleocapsid, it means it didn't work for you. It means you got the natural infection instead. So you have to be careful because each antibody test is different.
Right.
Susie,
Yeah,
can I add something to that?
Sure.
Okay, after vaccination, individuals will be followed up for at least a year for vaccine outcomes. And because we want to measure vaccine effectiveness, there will be people who may report illness, and we want to make sure that they have not been infected with COVID-19. This is not to measure their antibodies, but to verify, confirm the diagnosis. There are reports now that after vaccination, people still got COVID in between the first or second doses. And because this is an emergency use authorization, we want to find out. And also, we want to know whether or not this illness has happened just as a coincidence because it it was already incubating before the vaccine was given. Thank you.
Okay, thank you very much. Thank you very much, Eric. There are many comments for Roby here in the chat box, and so I wanna ask a question for Roby and for everybody because this webinar series was set up so that we could do in-depth discussions with the healthcare providers. So and Roby's talked about information resilience, which I think is very, very important. Roby, you've talked about face-to-face communication. What else should the government and the private sector be doing? You've talked about pamphlets, face-to-face, etc. What else should we be doing to make sure that we are, what should I say, that the population, I mean, apart from, I think, directly addressing what leaders say about the pandemic that's not useful for the public, what else could we be doing?
Well, let me direct you, Susie, to your own experience. Now, when you were in DOH with former Secretary Clavier, where there was a lot of best practices between the public and the private sector, not just in lending the logistics and the supply chain of the private sector, but really lending the expertise and the sophistication of the private sector when it comes to communication. And it doesn't just translate to mass media campaigns, it translated to collaterals being produced on behalf of the ano. So I did read the book on that, as you know, on your documentation of how innovative communication strategies were employed, and it came up with many things. No, fast food chains lending their packaging to information material, lending their sites ultimately to become patak centers for immunization, and so on. Getting celebrities also to endorse. This is not to denigrate the potential of social media and mass media. Actually, one of the things that's surprising when you do listen to the news, particularly the man on the street interviews, is may pinanggagalingan yung skepticism as well as knowledge ng mga tao. You ask them anong pinakang effective, alam nila kung anong pinakang effective. Alam nila kung nasaang nawala pang phase 3 clinical trials results for particular vaccines. Alam nila yung efficacy rate, alam nila yung presyo in the different markets and jurisdictions. So people do get this. And then getting influencers involved as well, obviously, is an important thing. What I wanted to emphasize is what we cannot rely on, which is a purely digital strategy, particularly when it comes to the wrong information and to misinformation, disinformation, whether it's deliberate or just simply unfortunate. What we can share with you and what we know is that fake news and fact-checking efforts will not work. They're not on its own. It's very, very ineffective. All the data from Facebook and Google and their efforts to counter fake news shows that when the wrong information goes viral, you cannot catch up. You can have 10 mainstream media producing a fact-check article and say, fact-check, this has been debunked. That will never catch up to 10% of the original virality. So that's what we're saying. Do not rely on that, and instead focus on the tried and true methods. And a lot of them are really not that old and not that new and not that sexy.
Okay. Thank you very much, Robbie. I think we're getting close to the hour, so we're going to the opinion poll questions. And Raymond, you want to take that and ask? I think we're going to ask the FDA to answer the questions. So go ahead, Raymond.
Okay. So I'll just read off the list. I have another question, Dr. Susie, but maybe later after this poll has been finished. So for the first one, EUA means emergency use authorization. So Director Joyce, mukhang tama naman po ang ano nila, no? Ang kasagutan nila for the most part. I mean, 96% answered yes po.
Yes, correct, Doc Susie and Raymond. Correct yan.
And then number 2, which of the following has an EUA from the FDA? So perhaps you can reiterate po what Director General Domingo mentioned.
Yes, for now, it is still Pfizer-BioNTech that has an emergency use authorization issued last January 14 of your Food and Drug Administration Philippines. Over.
Thank you, Director Joyce. And then finally, just the answer to the vaccines are already available in the Philippines?
It's not available as in commercially that you can buy in your drugstore. No, the EUA, the emergency use authorization allows the government to procure, but it will be through the government's vaccination plan. You cannot buy it in drugstores or it's not commercially available. Let us wait for the certificate of product registration, which is likely in 20, like what DG Eric has mentioned earlier, it could be in late 2022 to 2023.
But that's the commercial availability. The
Yes,
government will have it in a few months. Is that correct?
There is, well, based on the information as shared of the media, it could be February, next month.
Okay, great.
Next month,
okay,
the earliest. Okay.
Raymond, go for your last question, then we'll need to do a roundup. Okay, go ahead.
Dr. Susie, Yes, Dr. Susie, this has been repeated po kasi in YouTube, in Facebook, and also in our Zoom Q&A box. I just want, maybe we could get someone from the government to state. So there are individuals who say that I would rather wait for this, for vaccine X, than have me injected with Sinovac and that sort of thing. For just for categorically, if they can answer, can an individual, whether or not you're a healthcare worker or priority individual, can you really choose which vaccine you would want for that? That's one of the questions po kasi that is on in the Q&A.
Maybe that's for Eric Tayag. Eric, go ahead.
Okay, the vaccines will be allocated to specific vaccine facilities. And so, if you were assigned to these facilities, these are the vaccines that will be available to you. But because this is voluntary, you may choose not to get the vaccine after all explanations were given. That's where the informed consent comes in. And that's also an opportunity to provide health education to all those potential vaccinees. And so, you have to wait for your turn, but you cannot go to another facility because there are QR codes that marks you to a particular facility. Over.
Okay, thank you very much, Eric, for that question. So I think we're going to hear more from the Department of Health as we get closer to the actual vaccination rollout. And at this point, I'd like to ask everyone to give their short final parting words to our audience. We're going to start, of course, with the Food and Drug Administration on behalf of Eric Domingo. Director Joyce, would you like to just say a few words?
Thank you very much, Doc Susie. In behalf of DG Eric Domingo, is currently in the Senate, the Food and Drug Administration will do its best to make sure that the products that we're going to give an emergency use authorization pass through all the needed scientific and technical review. Uh, have trust in your Food and Drug Administration, because these applications that we are going to issue an emergency use authorization, it passed through all the stringent requirements to protect us, the public, who wants to be vaccinated. Over to you, Doc Susie.
Thank you very much. Let's have some words from Eric Tayag. Eric, go ahead.
You're on mute, Director Tayag.
Thank you, Susie. Thank you, Raymond. And thank you, everyone, the organizers, for this platform, allowing DOH to explain everything or something about vaccine deployment. Vaccines do not save lives. Vaccination saves lives. Thank you.
Thank you very much, Eric. Let's have Paolo.
Well, first of all, Susie, just a big thank you to yourself for hosting, and again for the organization for getting us together. I'd like to echo what Roby mentioned earlier. I think during your time when you had the public-private sector engagement, it's extremely encouraging and heartwarming to see the extent of the public-private sector engagement this time around. I don't think it gets that much attention, but behind the scenes, and Director Tayag knows this, but behind the scenes, we're working very closely with the DOH, the IATF, and vice versa. So, Director General Eric, pakisabi po, Ma'am Joyce, he's been so helpful, and we're just behind them 100% of the way. And sa amin po, sama-sama tayong lahat dito, and tulong-tulungan lang tayo.
Thank you, Paolo. Roby.
Yes, I just like to thank everybody as well, the organizers. I personally did not want to take any time away from the scientists and the researchers and the technical people and the policymakers. But I do think it's an important message to have. And coming out of modesty as well, and in all humility, we know that media is part of the solution. We also know we're part of the problem. And part of the dilemma is really in that dual role. On the one hand, we do want to amplify information, and so I think as I said, we've had many of you as guests on our show, and we very often try to take scientists, technical people on our show as our guests. It's inevitable also that we need to talk to policymakers and the actual executives in government. And we tell them that kahapon lang ang kausap namin mga scientists, we felt so reassured. Na kausap namin mga politiko at saka mga executive, honestly, sir or ma'am, we are so confused right now. And we try to give that feedback. And we can imagine, therefore, what is the effect on the public as well. So I guess my message here is we try to play our role, but for those who are really concerned about the rollout now, about the vaccines and social behavior and our public behavior, you have to look beyond the news and media sector and really come together and think what is a multi-sectoral effort outside of mainstream media that we can undertake that can be insulated from the politics.
Thank you very much, Robbie. Dr. Franco, a few words from you.
Just four things. Remember, COVID-19 is deadly. 0.5 to 1% is will die from COVID if you're infected. 5 to 10% will be disabled by COVID if you're infected. Number two is 70% of the population will be infected. That's the herd immunity. And most countries are not even 25% yet. Number three, the vaccines are all efficacious, 50 to 95%. 50 is not bad. Modeling studies have shown that if you have 50% efficacy with more patients being vaccinated, it's superior to a 95% with limited vaccination. Number four is 95% of the side effects are mild to moderate. So remember, you cannot outmutate COVID-19, but you can vaccinate against the virus. Thank you.
Thank you very much, Dr. Franco. We've got Chancellor Menchit Padilla who's going to give us a brief summary of our webinar today. So Menchit, over to you.
Okay, very challenging webinar. Okay, so our topic today is, are we ready for COVID-19 vaccines? So we had the session was opened by FDA Director General Enrique Domingo, who welcomed the audience to this, the audience of more than 1,000 actually, to talk about the readiness. He announced the approval of the Philippines as part of the COVAX facility, which is a step towards equitable distribution. And since the Philippines belongs to the low and middle income category, the Philippines will receive 40 million doses or for 20% of our population. And since we know that that is not enough for the Philippines, DG Domingo actually assured the public that the government is actually making arrangements with other manufacturers so that we can meet our target of about vaccinating about 50 to 70 million this year. DG Domingo actually assured the public that the National Task Force and DOH are ready to face this challenge of immunizing the population to attain the needed herd immunity. Let me just go to the highlights of the speakers. DG Domingo actually gave us an important message on the importance of FDA in the whole picture. He started off by telling us what is the mandate of FDA. The mandate is to ensure safety, quality, and efficacy of health products. And it's not only talking about vaccines and drugs. It includes processed food, medical devices, and household substances. So since vaccines would be in the mandate of the FDA, they actually are engaged in the product registration. They are part of the whole system for the clinical trials and the product registration. The DOST and the DOH are part of the big picture because they screen the vaccines that have to be considered. DG Domingo actually said that there are many ways for the authorization. We have the certificate of product registration, that's one, the compassionate special permit, number two, and the drugs for emergency use. Now, if you remember that figure wherein he showed the pathway of the development of the drugs or the vaccine is really very long, from discovery, preclinical, phase 1, phase 2, phase 3, product registration and approval. And ordinarily in normal situations, you have to go up to you have to finish the phase 3. But because of the emergency situation right now, the emergency utilization authorization has been utilized in the world and in the Philippines so that in these not normal times, we can actually use these vaccines. It has been recommended that at least 50% of the vaccine have been monitored for at least 2 months. That is the start. But he reassured the public that the Philippines actually is in alignment with the rest of the world. He said that EUA in the Philippines has the following categories. Number one, it's reasonable to believe that the drug or vaccine may be effective, and that we do have the efficacy data. Number two, the potential benefits outweigh the potential risk. And number three, there is no adequate approved and available alternative. DG Domingo actually reiterates that we have an expert panel behind the scene, from the technical team to the regulatory team. So his reminder now, maybe a few reminders for the audience, that the EUA, the Emergency Utilization Authorization, is valid only during the declared pandemic, and that there is no shortcut to safety and efficacy, and that, hold on, excuse me, and that the EUA is not a marketing authorization. He actually reminded everybody that the distribution should follow the national vaccination plan, and it's a very complex one. I will not go through it. And there is no way that a single organization, agency, or office can actually do it, because it ranges all the way from the cold chain, the vaccination providers, the pharmacovigilance, to the consent and the reporting of adverse events. So his message for us is that while we are still waiting for the vaccine, read up. We had 4 reactors today. For Dr. Enrique Tayag, he started by saying we really have to go back to the basics of physical distancing, the face mask, the face shield, and he said stay home. He supported the comments of DG Domingo, but what I'd like to emphasize was the point that he said that the Department of Health is actually working with the LGUs. And before the vaccination happens now, they're getting a master list of all the individuals who will be prioritized. All the vaccination facilities will have to be registered to make sure that they have the qualifications and they're able to monitor the cases that they will be immunizing. He appreciated the very short flow from 254 days in the past, now down to 21 days, and we thank FDA for the shortened flow for the approval. So it's the same message. He said, read up, but he warned us. He said, reading is not enough, because a little knowledge can be dangerous. And as a matter of fact, aside from reading, somebody has to explain it to the patients. Our next reactor is Paolo Borromeo from Ayala Care. And I mean, the part I appreciated in his presentation is when he said that the private sector must work with government. It's the correct way to do this. And because for 2 reasons. The policy reason is that somebody should prepare the allocation. So you cannot just order 10,000 or 100,000. It has to be a total approach. And that for economic reason, we need a consolidated large enough pool. We appreciate the commitment of the private sector in saying that they will coordinate with the government. We also appreciate in their statements that they are working behind the scene with IATF in different streams, from procurement, distribution, offering vaccination sites. More than ever, I think this is a time wherein we can see the government working very closely with the public sector. Our third reactor is Roby Alampay. It starts off by saying information saves lives. And thank you, Roby, by saying that you feel reassured when you hear the scientists telling us that the data is very reassuring, and then saying that the problem with media is that when we get conflicting statements from other sectors of society and government. 2 things that we must remember. He said, yes, we're in the stage of technology. And yes, we have actually the digital news, but we should not actually limit our information campaign to the digital world. And we can also depend on the traditional ways. He said the door-to-door campaign, the town halls, the pamphlets, going down to the communities, the radio, the schools, the marketplaces. These are all very important components of campaign. And he says in summary, he said that we need an information resilient population. So again, he said that, a little information, just like Dr. Eric said, is good, but it can go the other way. Our last reactor is Dr. Franco Felizarta from the US, who talked about how they're rolling it out in the US. And well, just like in the Philippines, they've got their priorities. But let me just highlight a few things that he mentioned, which I think is worth remembering for the audience. The risk of dying when not vaccinated is much, much higher. Whether you're vaccinated or not, there is a risk. And he actually used the example of a 90-year-old as a 20% risk of dying, and versus a 20-year-old who has a 1 in 10,000 of actually dying. So in other words, there will always be complications, there will be deaths, but definitely there is merit to vaccination. He actually cited the importance of online appointment, which I think is very important to be implemented here in the Philippines. Very good example, he said, Pfizer has 5 doses, Moderna has 10 doses. If we are not able to schedule our patients, then there will be wastage. And definitely there is a need to train actually our vaccination teams on the complications. In summary, our speaker and reactors are one in saying that the readiness to COVID-19 is a whole of society approach, whether one is from the private sector or the public sector or just part of the general public. We all have a role to play to make sure that we are all ready. FDA is telling us, trust your FDA. We are making sure that the vaccines that we are distributing is actually safe. Dr. Eric Tayag says, vaccines don't save lives. Vaccination saves lives. Paolo Borromeo says, private sector is 100% in support of what government is doing. Roby is telling us, the media has 2 parts. We have to play a role. We have to play our own role in the rollout. And we've got to change the behavior to go beyond the media. And that, I like to think that media is a partner and should not be part of the problem. That's my personal point, okay? And for Dr. Franco, just to remember that regardless of what vaccine we're talking about, all vaccines are efficacious. Side effects will be there. They're from mild to moderate. But the important thing is that when the vaccines come, we've got to be ready. With that, I'd like to send it back to you, Susie and Raymond. Thank you.
Thank you very much. That's our very own Chancellor of UP Manila, Menchit Padilla, who just gave us an excellent summary of a very interesting webinar that we had. Before I tell you what's happening next week, Raymond, did you want to do a quick evaluation?
Okay, I think a lot of our folks, can we have that TVUP? I'm not seeing the evaluation of our panel. I'm seeing the post opinion. Okay, thank you. So we have panel evaluation, which is traditional for all of our webinars. I'll just read off the list, and I hope. I think the poll is closed. But so 86% of our attendees found that the panelists demonstrated thorough knowledge as well as prepared and organized their thoughts and conveyed them pretty well and spoke clearly and audibly on the topics at hand. 84% found that the panelists use appropriate language with technical medical jargons adequately explained. And finally, 85% observed that they were able to learn new perspectives and knowledge on managing various key COVID-19 health issues. So thank you to our excellent panel of speakers. Maraming salamat po.
Okay, thank you very much, Raymond. Thank you so much, Raymond. Next week, okay, so every Friday, Raymond, this is the 38th week. Pwede na tayong mga anak, no? Di ba? 38 weeks ba? Okay, so next Friday, we're going to have a very interesting topic. We're going to talk about safety. How safe are the COVID-19 vaccines? And it's not just the vaccine, but the vaccination process, who should get vaccinated, etc., etc. And we will have none other than Dr. Eric Tayag as one of our speakers. We're also going to have Dr. Tony Dance from UPPGH, and I think we're going to have another infectious disease specialist. So please share. You can watch this video again on YouTube. You can share it. I think it was an excellent presentation by the FDA and excellent insights from our panelists. So I'm going to watch it again tonight. I hope you do too. So be with us next week. We're going to talk about vaccines again, and it's going to be how safe are the COVID-19 vaccines. So I'm signing off. Together, we can make the world healthier. Raymond.
Thank you, Dr. Susie. So for those who are asking, especially for those who would want a copy of that excellent presentation given by Director General Eric Domingo, that is actually a video clip, and we'll try to send it and give you a link to that video clip in our Google Drive from Stop COVID Deaths. You can really watch it on the playback from our Facebook and our YouTube channels over TVUP and the Stop COVID Deaths channel. And as mentioned by Dr. Susie, we look forward to seeing you all again next week, January 29th, if I'm not mistaken, 12 noon to 2 p.m. This is Dr. Raymond Francis Sarmiento on behalf of the Stop COVID Deaths webinar series team. Stay safe, stay healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The other's pain before my fears, the other's love before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The other's pain before my fears, the other's vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The other's pain before my fears, the other's loves before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The other's pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold